Hey friends, today I want to talk about how we can use our awareness and our ability to feel to assess and address injury in our movement practices. Now, I'm not a doctor, and so these particular tools that I'm going to offer are simply tools that can help you to do some self assessment and figure out and troubleshoot what's happening in your body when you have an injury and what exacerbates versus what supports this particular issue. Now, before we go any further, I do want to say that because I'm not a doctor, I highly encourage you to go see a professional if any injury or pain persists for longer than 2 to 3 weeks. Now, with that said, there are a number of things that we can do for ourselves to help determine what the issue is and how we can start to address it. Now, the first thing that we want to figure out is whether the injury is muscular, within connective tissue, or within joint. Muscular pain or muscular injury, so for example, if you were to tear a muscle, happens in the meat of the muscle, so in the middle of the muscle, and ideally not injury that you're talking about that's close to a joint. Now, muscular injury is the easiest to heal because muscles are highly vascularized. What that means is that they have a ton of blood flow, which allows the muscle to heal more quickly. When we have muscular injury, the first thing that we want to do is avoid stretching. So, if you have a muscular injury, no stretching that muscle until you're out of pain. If you have a muscular injury, what you want to do is start to engage the area around the muscular injury as soon as you're able to without significant pain. So, in order to heal an injury that is in your muscle, you want to engage and shorten that muscle pretty much as quickly as you're able to so that the muscle can heal well. Now, that's if you have muscular injury. If you have an injury that's in your connective tissue, which is your tendons and your ligaments, there's a little bit more complex work from there that we have to consider. Now, tendons connect muscle to bone, so that's close to the joint or close to the end of the muscle. Ligaments attach bone to bone, so those are generally within and surrounding your joints. Ligaments and tendons are very minimally vascularized, which means that when we injure them, that we have a longer healing process. So if you hurt a ligament or a tendon, the first thing that you want to do is stop whatever movement practices you're doing and give it a solid 2 weeks of rest. In addition to that, you want to support the area that's injured, whether it's a ligament or a tendon, by strengthening and engaging the surrounding muscles. So, for example, if you tweaked your knee, one of the ligaments in your knee, one of the first things that you want to do is rest it, maybe wrap it, maybe even ice it, take some ibuprofen, etc. But in addition to that, you want to make sure that the muscles that are around that injured joint are able to be engaged. So, what you would do is strengthen the muscles of your shin and calf. So, for example, by lifting your toes, and also strengthen and engage the muscles of the thigh, the hamstrings, and the quads, so that everything that's around that injured area is strong and supported. You're going to want to do the same thing if you injure within a joint. So, for example, say you injure your wrist, you want to rest it for a number of weeks so that that area can reduce inflammation, can go in and do its own healing juice. And then you want to strengthen everything around it so that that joint is supported. So, again, first thing that you want to do, just to repeat, is to determine whether it's muscular, connective tissue, or within the joint. Any joint or connective tissue injury is something that you want to be much more careful with and give it a bit of a longer time to heal. Now, that's helping us determine where the pain is and what's causing it. Another way to help us figure that out is to determine what kind of pain it is. So we describe the pain. So is the pain sharp? Is it dull? Is it achy? All of these descriptors and experiences of that pain are going to help us determine what the cause is and how to address it. So, for example, pain that's sharp and even sharp or electric. That's a big red flag that you want to rest and take a break and give the body some time to heal. Again, usually about 2 weeks is a nice rule of thumb. If the pain is achy or dull or pulsing, that's a little bit less concerning. And generally, stuff that's deep and achy and dull often is muscular. So that can help you to determine that. Another thing to be considerate of in terms of dull and achy pain. So, for example, say that you have an ache in your upper back. That's a pretty common issue that we see in people who have bodies. The reason that that happens is because those muscles are constantly a little bit overstretched when we slouch. And so pain in a muscle that's sort of achy and dull and consistent can very often be alleviated when we engage the muscle that hurts. So we shorten it and we turn it on, and we stretch the antagonist. So if your shoulder is achy, you stretch your chest, right? So the opposite muscle. So that's a really nice rule of thumb if you're having that sort of dull, achy, deep sort of pain. Additionally, any electric pain or radiating pain is something that can sort of signal that there's nerve issue happening. Right? So if you're feeling something sharp, electric, or that sort of radiates down the body from the center, those are sort of signs that your body's saying, hey, there's something potentially in the nerve that's happening, in which case you might want to go see a chiropractor or an orthopedist. So first and foremost, where is the pain? Can you figure out if it's muscular, tendinous, etc.? Second of all, what kind of pain are you having? Describe it. The next step is to figure out how consistently you're experiencing this pain. Is it happening all the time? Does it only happen when you're doing certain things or after you do certain things? Pain that's consistent, we're a little more concerned about that rather than pain that sort of comes and goes depending on what you're doing. We're also interested in what particular movements and shapes and things that you're doing in your body that are making the pain worse. So is it worse when you get up after sleeping all night? Is it worse after you've been sitting at your desk? In addition to that, you can flip it, right? Is there anything that makes the pain feel better? When you do your yoga practice, does it help? Are there particular poses or movements or shapes that make the pain better or worse? And as you start to determine what is alleviating the pain versus what's making the pain worse, you can use that information to sort of fine tune how you're doing your yoga practice and what kind of movements you're doing to hopefully make it so that you can support what helps you and eliminate what's making the pain worse. The final thing that is really helpful when you're working with injury is to be curious how long the pain has been happening. So is this something that's been consistent for you for months, for weeks? Is it acute, right? Acute means that you've been having the pain for 2 weeks or less. Or is it a longer term pain that's been happening for weeks or months or even years? So again, when we have injury that's longer term, so once you've been in pain for more than like 2 to 4 weeks, that means that there's something happening that shouldn't be happening. And we start to troubleshoot. And if you can't troubleshoot it using some of this stuff that I've offered today, then you go to a doctor, an orthopedist, a massage therapist, etc. And again, in terms of yoga in particular, the best thing that you can do when you have an injury is get very, very clear as to what poses create relief versus what make it worse. You want to be very careful about how you address this. So for example, again, we'll go back to that feeling of knee pain. So if your knee was to hurt in a yoga pose, what happens when you lift your toes up and engage your shin and calf? Does that help? What happens when you pull your leg in, right? When you compress into the joint and bring the joint into a more contained space versus what happens when you reach out of the joint? Does making space in the joint make the pose feel better, make the area of pain feel better, or does it make it worse? And so you can get really curious as to what movements what actions, whether traction or compression, whether engaging or softening, the areas around the injury start to support your relief, right? And so you can use all of these assorted tools to start to suss out what's hurting, where is it hurting, why is it hurting, what's making it better, what's making it worse. And so I invite you to explore and take ownership of your injuries, of your tweaks, and use them as opportunities to start to be more curious and more fascinated, right? I know for a fact, personally in my own practice and in my own body, that being injured can be really challenging, really troubling, really discouraging. And what yoga asks us to do is flip that story on its head a little bit and use our injuries instead as a way to learn, as a way to get more creative and troubleshoot, and to learn how to apply our yoga practice in a more masterful way. Now, with all of that said, if any of this information feels overwhelming or you need specific information about a particular joint or a particular injury, you're very welcome to reach out to me directly. You're also encouraged to find people locally, massage therapists, craniosacral therapists, Reiki people. Have a reference list. And if you don't know who to ask, find someone you trust and ask them, or come and connect with me. I'd be happy to help you find someone who can support your healing process. All right. Thank you all so very much for joining me for this video. And hopefully this helps you to take some ownership of your own experience and figure out how to work with your injuries and your tweaks in a way that is safe and healing and helps to continue your spiritual growth. Thanks, friends.